Welcome back. The fight over Obamacare continues as Democrats are railing against the GOP plan to repeal and replace the law. Giants health insurer Aetna announced this past week that it will completely pull out of Obamacare, citing staggering losses from participating in the plan. They said that they will lose $200 million. Joining us right now to discuss the future of health care in America is the CEO of Cleveland Clinic, Dr. Toby Cosgrove. I want to get your take on where growth is in health care and where the innovation stands today. But first, let me get your take on the health care battle. As a seasoned surgeon and somebody who's been a student of health care for so long, what do you think is necessary to have in a health care law, and how do you see these back and forth between the right and the left on this?
Well, let me just change the discussion just a little bit. I think what we're really missing as part of this discussion is what the root cause of the problem is. And the root cause of the problem that everybody's trying to deal with, but not really addressing it straight up, is the increasing cost of health care. And it's really increasing for two reasons. One, we have more older people, and two, we continuously have more things we can do to keep people well and return them to health. Now, there are a lot of things that we can do, both in federal government can do, legislatively and administratively, that can make care more efficient and keep people well. The first thing is we've got to figure out how we have efficiency for looking after people who are sick. There are things like we need to bring hospitals together in systems instead of having them stand alone. About 2/3 of the hospitals now are part of systems, but we can't have them all being independent, purchasing by themselves, competing with each other. We need to have that efficiency, and we need some help from the Justice Department and the Federal Trade Commission to allow us to consolidate like every other industry has. Then we're under a tremendous burden about regulation. Last year, 2 years, we've had 43,000 pages of regulations. We report hundreds of quality measures to the federal government, and we're inspected all the time. We always have somebody inspecting us in the hospital almost every single day of the year. So there's a lot of things that the federal government could do. It could also, but we also have to figure out how we deal with the nation which is not taking care of itself.
What do you advise President Trump on this? I know that you are on a part of his policy forum where he's looking to business leaders for advice on this. What do you advise him in terms of what's most important with regard to health care?
Well, we've suggested to the administration that they need to address the things I talked about, try to get a bipartisan bill that will begin to look at all those things that we can do to reduce the cost and set the nation on the right track for a very long period of time. We are going to, like every other nation, begin to have to deal with the rising cost of health care, but we need to put things in place right now that can begin to bend that curve. And, we've had an example of how we can do that in our own facilities.
All right.